If you want awesome products at great prices, check out the in the description. A startling omission: racial disparities in maternity care and the NHS data gap. The National Health Service, NHS, in England is facing intense scrutiny for a glaring oversight in its data collection practices. A shocking failure to record the ethnicity of individuals pursuing legal action for subpar maternity care. This omission comes despite overwhelming evidence of significant racial disparities in maternal and neonatal outcomes, a disparity so stark it demands immediate attention and comprehensive reform. Black, Asian, and minority ethnic (BAME) women disproportionately experience severe harm during childbirth, a reality extensively documented in numerous studies and reports. Yet, the NHS, the very institution responsible for providing care, lacks a crucial piece of the puzzle: the ethnic breakdown of those who have experienced such harm and sought legal redress. This absence of data directly impedes efforts to understand, address, and ultimately eliminate these systemic inequalities. The data gap came to light following Freedom of Information requests submitted by Lyme Solicitors, a London-based law firm, to NHS England, individual trusts, and NHS Resolution, the body handling medical negligence claims. The firm's findings revealed a startling blind spot: a critical absence of information that undermines efforts to improve care for BAME women. The consequences of this data deficit are profound. Without a clear understanding of the ethnicities of those affected, it's impossible to accurately assess the scope of the problem, identify systemic issues within specific trusts or regions, and implement targeted interventions. This lack of transparency is not merely an administrative oversight. It's a systemic failure that perpetuates existing inequalities and undermines the trust BAME communities have in the NHS. The statistics paint a grim picture. Black women in the UK are nearly 4 times more likely to die during pregnancy or childbirth than their white counterparts. The mortality rate for Black babies before 24 weeks gestation is double that of white babies. These stark realities underscore the urgency of the situation and highlight the critical need for comprehensive data collection. Professor Habib Naqvi, chief executive of the NHS Race and Health Observatory, aptly summarized the situation. Incomplete data leads to flawed healthcare decisions, ultimately leaving the most marginalized communities underserved and inadequately cared for. The government itself acknowledges the need for better data collection to address the stark inequalities faced by women and babies. The Department of Health and Social Care has explicitly stated its commitment to improving data collection as a crucial step towards achieving equitable outcomes. An NHS spokesperson responded with a statement acknowledging the severity of the situation, emphasizing that no woman should experience poor care due to her ethnicity or background. The spokesperson further highlighted the immediate action being taken to improve data collection practices, with a focus on identifying and reducing inequalities. However, words alone are insufficient. Concrete steps must be taken to ensure that data collection accurately reflects the experiences of all patients, enabling a comprehensive understanding of the disparities and facilitating the development of effective, targeted solutions. This isn't just about numbers, it's about lives. The lives of mothers and babies are at stake. The NHS's commitment to rectifying this data gap must translate into immediate and sustained action, ensuring transparency, accountability, and, most importantly, equitable access to high-quality maternity care for all. The current system fails to provide this, and the consequences are devastating. The fight for better maternal health for BAME communities requires a concerted effort, beginning with the collection of complete and accurate data. The lack of this crucial data represents a fundamental barrier to achieving health equity and must be addressed without delay. This is a moral imperative, not merely a data point. The time for action is now. The lives of countless women and their babies depend on it. This critical oversight necessitates immediate and sustained reform across all NHS trusts, ensuring that every voice is heard, every experience documented, and that every individual receives the care they deserve, regardless of their background. The failure to collect comprehensive data is a failure to protect the most vulnerable members of society. Addressing this systemic issue is not optional, it's essential. The future of maternal health care in the UK depends on it. The NHS must demonstrate a tangible commitment to improving data collection and tackling the alarming racial disparities in maternity care. A comprehensive and transparent approach is needed to ensure equitable outcomes for all. The absence of this vital data has dire consequences, contributing to ongoing harm and hindering progress towards achieving health equity. This failure demands immediate and decisive action from the NHS and the government. The commitment to improve data collection must be translated into tangible results, empowering the NHS to effectively address the disparities and provide equitable care for all. The current situation underscores a fundamental lack of accountability and transparency within the system, impacting the health and well-being of numerous individuals and families. Urgent reforms are required to redress this imbalance and prevent future tragedies. This is not merely a matter of statistics, it is a matter of life and death. The fight for better maternal health care for BAME communities requires immediate and sustained action, beginning with comprehensive and transparent data collection. The time for change is now.